Hi everybody, I hope you're all well, and today I'll be talking about does pseudoephedrine work for migraine. This is an over-the-counter drug you can get without a doctor's prescription. Pseudo means false or untrue. An example of that would be a pseudo-intellectual who thinks he's smart but he's really not very smart. The ephed part of it comes from the ephedra, which is a plant that grows out in the world. It has unusual spelling. I'm just going to go over the Swedish so we'll get straight exactly what we're talking about. It could be pseudoephedrine. It's spelled pseudo, P-S-E-U-D-O-D-O, ephedrine, E-P-H, E-D-R-I-N-E, or it can also be spelled pseudophed, where it's spelled pseudo and then F-E-D, or also spelled phonetically, which is S-U-D-A-F-E-D. So it's all these spellings. That's the way it appears in the marketplace, just so you'll know what I'm talking about. And the drug is really a mystery drug for a lot of persons, especially migraineurs and people with allergies. They don't really know how it works and what it's doing to them. So the question has also been, does pseudoephedrine work for sinus headache? Well, they've marketed for that since the 50s. It's a very deceiving term because migraine has misnomers and there are terms that go with it. So some people will have like drugs that kind of are named like migraine, but they're really not migraine. The patient who has these symptoms may have migraine, but they don't know they have migraine. Something like 56% of persons who have migraine have never had a diagnosis made by a doctor anyway. So migraine hides in the late consciousness, not well diagnosed or understood. So what are these other names for migraine? There are sick headache, sinus headache, menstrual headache, letdown headache, weekend headache, Saturday morning or Sunday morning headache, nocturnal headache, and things like that. It's also called sinus headache. So how does pseudoephedrine then work? Well, it's a drug that works for nasal congestion, like for allergies or a cold, and also works to stimulate your brain so you kind of stay awake for wakefulness and things like that. But it's a weakly effective drug for treating migraine. It's a sympathomimetic drug also. It activates the sympathetic nervous system. It was discovered in 1889 by the Merck drug company. And it comes in two kind of combinations. There's a, pseudoephedrine HCl, which is the main way it comes, and also it can attach to sulfates. And examples of pseudoephedrine drugs, I'm just going to read some of these so you'll know what I'm talking about when I say them. 12-hour cold maximum strength, chlortrimeton nasal decongestant, simply stuffy, and Sudafed. Those are drugs over the counter that are used. A lot of times used for pediatric aged persons. So how does it work? Well, pseudoephedrine causes vasoconstriction of the cerebral arteries and also the nasal arteries in the nose. And by doing that, it seems to help. So like if you get a cold or the flu or have allergies, the arteries in your nose dilate and your nose gets stuffy. You can't breathe through it. It runs. It has a lot of clear fluids and mucus. And so if you can dry up the mucus and also open up the arteries, it's called a decongestion that helps the person suffer with, an upper respiratory infection or allergies and things like that. It also works in the brain or the cerebral arteries to cause vasoconstriction. And migraine is a condition where the arteries dilate and they're inflamed by chemicals in the body. So you've got this dilated artery that can be constricted a little bit by pseudoephedrine. A weak drug for migraine is nothing big for it. If you put something in the nose like Afrin is not a pseudoephedrine type drug, but people know what I'm talking about there. If you put it in your nose for too long, it'll cause this rebound problem with nasal congestion. It's just horrible. And you have to the only way you can get rid of that is use salt water nasal drops and don't use the Afrin anymore. And generally don't take it more than a couple of days. I think that's now on the bottle now, warning people, but it may not be. Pseudoephedrine has rather common unwanted side effects, and it's like caffeine. People get addicted to this stuff, and so the dose goes higher, and as it goes higher, then you'll have more untoward side effects. Side effects are central nervous system stimulation, hypertension, trouble sleeping, dizziness, anxiety. You can have rapid heartbeat from it. It can make your pupils dilate. Some people rarely have had hallucinations or psychosis. It can aggravate high blood pressure and give you seizures. There's ischemic colitis that's affected with it and also cause change of your skin that's called recurrent pseudoscarlatina symptoms with redness of the skin. Dermatologists usually diagnose that. So there are precautions, and it's contraindicated for certain medical problems like diabetes, high blood pressure, cardiovascular disease, persons with a prostate condition, acute angle glaucoma, pregnancy. It's not approved at all to be used in children. And it can also aggravate other neurologic conditions, such as persons with panic attacks or anxiety or trouble sleeping have a lot of trouble with that taking Sudafed. One thing I've always done as a physician is try to take a good history of all the drugs the patient's taking, and you will see then, like somebody's taking 400 to 600 milligrams of caffeine a day, that'll make you kind of edgy and not sleep well. Or if they've taken Sudafed, that can aggravate problems with sleep. You can also get aggravation of tremor, with shaking of the arms and head that can come with overuse of the drugs. Typically, if you have a tremor condition anyway, such as Parkinson's disease or essential tremor, that tremor can get worse using Sudafed. It is also a drug that can interact with monoamine oxidase inhibitors, causing really some blood pressure spikes. Those are drugs that treat depression and psychiatry, and so if you've taken that drug, you have to be off of it like a couple of weeks before you can use Sudafed with it. It can increase ectopic pacemaker activity in some people, particularly when it's used with digitalis. And antacids taken for like Tums over the stomach, over the counter for the stomach, can cause a decrease in the amount of a drug in the body of Sudafed. So the question then has also been whether it helps sinus headache. So the headache may get better from taking this medicine. And a lot of people will say that it does, but it will not get rid of the headache in 2 hours and won't generally keep you out of the emergency room. If you take too much of it, you can get into the problem of medication-overuse headache. And medication-overuse headache is the #1 diagnosis for new patients for doctors who have a headache practice. All right, so a patient with sinus headache would be better taking, if they have migraine, and most of them do have migraine, they'd be better off taking a triptan, which is indicated for migraine. And triptans can make 80% of persons who have a migraine headache free in 2 hours, and usually one dose works for most people. That's why they've been remarkable, wonderful drugs. There's 7 triptan drugs now, and they came out about 30 years ago, and they're still the best drug. They're all generic, they're cheap now, and it would be better to take that than use something like Sudafed. Sudafed also has a dark, stormy side also. It's been on an FDA newsletter alert giving the doctors saying they're addicted and it causes all kind of problems for years. It has misled the American population since the 50s with TV ads talking about sinus headache there. Just stories I've come across in my own life. The Wall Street Journal in November of 2019 discussed an article about some guy at LaGuardia Airport in the men's bathroom had a meth lab, and he was making that from Sudafed. That's the other thing people don't know, is that methamphetamine, a very addictive drug, can be made in a lab with chemical changes of Sudafed, and that's why Sudafed is such a problem. Also in Dallas, Texas, where I live, several years ago, there was a drugstore story of a man that came in and wanted $5,000 worth of Sudafed, and he got it and was going to his car, and the druggist called the cops, and they met him at the car, arrested him, and took him home, and he had a meth lab there. He was going to sell all this to kids in the Garland school system. So the mafia is really who's driving the methamphetamine problems in America, and that comes from Sudafed, which is a real problem. So I wish you had clicked on like down there below and click on subscribe, and follow me on YouTube for other discussions. I have a migraine. God bless all you folks who have allergies and migraine and colds and flu, and I'll see you on the next talk.